Following the completion of the round 1 polio vaccination campaign from 12th to 15th November with 90% success rate, the Gambia government, UNICEF and WHO have launched yet another round of nationwide polio vaccination campaign. This campaign, which kicked off on Thursday, targets 400,000 children in the age bracket of 0 to 5 years. Details in this report.
The expanded program on immunization under the Ministry of Health on Wednesday convened a press briefing aimed at raising public awareness of the second round of the whole nation polio vaccination campaign. Health Ministry officials reported a 90% success rate for the last campaign and have in fact set a more ambitious goal for reaching 99% of their target this time round. Since the confirmation of the first polio case in the Gambia in 1986, the country never faced a threat from the virus until in July of this year, when a polio outbreak was declared through environmental surveillance. Despite the success of the first round of vaccination campaign, the manager of the expanded program on immunization, Basidat Fofana, highlighted the need for another campaign to target those children between 0 and 5 years who were not vaccinated during the previous round to effectively deal with polio.
We cannot eradicate the disease if we are leaving people who are not vaccinated. And this is because some parents are not clear. This is the same polio vaccine that we normally get at the health facilities. So we got this one because it's a specific type of virus. If we allow it to spread, many children will be paralyzed in this country. Many children will die.
Mr. Fofana said, in a country where a lot of children are unvaccinated, there are bound to be a disease outbreak such as polio.
In fact, it's because of COVID-19 that we are having these problems now. Gambia, our last polio case was in 1986. Confirmed polio case, lab confirmed polio case. That was paralyzing the children here. It was our major outbreak in 1980. Since then, because of these women are going to the clinics every month, children are being vaccinated, they are protected. We are not having this. We are not having it. But because when COVID came, people fear going to the clinics. There were some rumors, and people were listening to them, unfortunately. Wherever you have a lot of unvaccinated children, know that we'll have one of these diseases will come. Either polio, either measles, either yellow fever, either diphtheria, either pertussis, either tetanus. One of them will come. In fact, in some cases, a lot of them will come and so many children will die. So to prevent that, the only way, surest way to make sure that we protect our population, our nation, as a small country, is to ensure that we go and take these children to this polio campaign and also the routine vaccination, monthly clinic attendance. That's the most important thing. So
in her presentation, Health Ministry staff Mbayan Jum noted that polio needs to be contained as it's currently an outbreak.
Currently an outbreak and needs to be contained, and otherwise it can infect and paralyze more children and spread to neighboring. And before it even goes to the neighboring countries, it goes from person to person, despite your age. And when it comes to vaccination, it's the most cost-effective public health intervention at all times. So it is very important for our kids, especially those under 5, to be vaccinated. The polio virus spread because there are under-immunized or unimmunized children in the country. So here what we meant is, under-immunized are those children that started immunization services at some point really had dropped. The unimmunized are those that are not at all immunized. So the virus can only be seen within this population, so meaning our population is susceptible. So it is important for children on monthly basis to attend routine immunization, despite we are having the campaign, but probably it's just one of, but we had also our routine immunization that under 5s are attending every month. And every parent should endeavor to make sure their children are being vaccinated on a monthly basis.
For Star TV, this is Omar Job.